Hi, and thank you for listening to the Big Diesel Fit podcast show. I'm your host, Stanford Smith. Today I have an amazing guest, Doctor Chelsie Rohrscheib. And so without any further ado, let's just get right into it.
Obstructive sleep apnea is a very common sleep disorder, and it's caused by individuals who have it have long pauses in their breathing when they sleep. And these pauses are usually due to obstructions in the upper airways. So what this means is something in the throat or nasal passage is actually blocking air from getting into your lungs. Usually, commonly, it's things like your tongue blocking your airway or tonsils. But every single time that individual stops breathing, and this can be many times per hour, people with severe obstructive sleep apnea I've seen stop breathing hundreds of times per hour. What happens is your blood oxygen levels drop, and your brain detects this and forces you to wake up briefly, even for seconds. So it's very, very short, so that you can restart breathing again. But the problem with this is every single time you wake up, and again, this can be multiple times per hour, it's keeping you out of those deeper stages of sleep that you actually need to feel well rested and restored. So even though somebody with sleep apnea can sleep a normal amount of time per night, they're not actually getting the sufficient deep sleep that they need. So this results in sleep deprivation, excessive daytime sleepiness, and for drivers, what we frequently see is drivers with obstructive sleep apnea have a tendency to fall asleep at the wheel because they're so sleep deprived. And this results in accidents, and it costs our economy billions of dollars a year in damages and lost productivity and lost wages and things like that. So it's a huge problem. And then when you combine sleep apnea with the long hours people tend to spend driving, that causes almost a double risk, because not only are they sleep deprived from the sleep apnea, also from the long hours as well. So that's why it's so problematic.
I noticed that over time, as I would gain weight, because I would gain weight, lose weight certain times. And whenever I would gain weight, I noticed that I would, snore more. Mm-hmm. And so I do agree with some of the stuff that they talk about in there. I did notice that a lot.
Yeah, and so weight is definitely a factor in developing snoring and sleep apnea. So if you're somebody who does have a job where you're sitting a lot and you're not moving around, you are at a higher risk. Now, I think sleep apnea is one of the more common sleep disorders to begin with. So 20 to 26% of men in America have sleep apnea, and 10 to 11% of women have sleep apnea, and most are undiagnosed. So 90% of people with sleep apnea have no idea they have it. They've never been tested for it, and they've never been treated with it. And the rates go up in certain professions, and it is certainly more common in people who drive for a living. And that is, again, due to the fact that when you're driving, it's more of a sedentary job. You're not moving around that much. So you are at higher risk for things like weight gain. And weight is not the only factor that predisposes you to having sleep apnea, but it can certainly make it worse and more common. So it's just something to keep in mind if you are somebody who drives for a living and you do have sleep issues, or you are somebody who has difficulty staying awake while you are driving, then it's definitely worth getting tested. I think, sleep apnea scares a lot of people off because they assume that if they get diagnosed, they're going to have to start wearing a CPAP, which is the machine that helps you breathe at night. And that is one of the more common treatments, but it's not the only treatment. And, it's not just an inability to stay awake while you're driving and all of the problems associated with the tiredness, but sleep apnea also increases your risk for a wide range of other health conditions too, like cardiovascular disease and diabetes and cancer. So it's really important that we provide testing to people who are in these fields to ensure that they are getting the best health outcomes that they can.
Now, is this in all the transportation industry? Because I did an interview with a pilot, and he was talking about the same issues that we were discussing as far as truckers are
Mhm.
concerned, sitting a lot of hours, drinking a lot of Red Bull at night, trying to stay awake.
Yeah.
So we dealing with the same. Is now this is across the board?
Yeah, yeah. So really any profession where you're mostly sedentary, but also professions where you're working weird hours. So pilots tend to fly in and out of different time zones, and they also work overnight a lot of times. So there's that. And then truckers have the same issue where they might be doing a lot of driving overnight and they're moving in and out of time zones. And that compounds on top of the sleep apnea because you're not only affecting, the sleep apnea, but you're also affecting your circadian rhythm, which is your biological clock that tells you what time of day you need to be awake and what time of night you need to be asleep. If you think about it, if you're constantly working odd hours and moving in and out of different time zones, then your circadian rhythm is going to get really out of whack. And it becomes harder for your brain to sleep normally because it's harder for your brain to keep time of day. So those things snowball into this huge problem. And that's why we see so many sleep issues. Even without sleep apnea, truckers usually have sleep issues, and people who work in shifts usually have sleep issues as well. So that's also something that we really have to educate people about and ensure that they're actually getting the help that they need.
How would you identify someone that you would think has this issue?
So sleep apnea has some pretty telltale signs and symptoms that would throw up red flags for me and other sleep professionals. So first and foremost, we look at the main symptoms, which are daytime sleepiness. So you feel like you're tired even though you slept the night prior. Maybe you feel like no matter how much sleep you get, it's not refreshing enough for you to stay asleep. People with bad sleep apnea tend to fall asleep at inappropriate times. So maybe when they're driving, maybe when they're in meetings, maybe when they're supposed to be doing some sort of physical activity. Another really common sign is snoring. So people who snore are at higher risk for sleep apnea because the same defects in your throat and nasal passage that cause those airway blockages can also cause snoring as well. So even if you snore a little bit or inconsistently, that still raises your risk for sleep apnea. But it's also important to note that not everyone with sleep apnea snores. So snoring is not necessarily a guarantee. But it is something that if it is present, you should definitely get checked out. So another thing that we commonly see in sleep apnea patients is cognitive issues. So this is things like you have poor focus, poor attention, maybe your memory is problematic, maybe it's harder for you to learn things. Maybe your mood has declined. So we often see like a lower mood or even depression in some of the worst cases. We also tend to see headaches. So if you're experiencing headaches, especially in the morning, that kind of gradually go away as the day progresses, that's a pretty common sign of sleep apnea. And then there's some not so obvious symptoms. So things that you wouldn't necessarily associate with sleep disordered breathing. So increased nighttime urination, if you're getting up a lot to go to the bathroom, that's a not so obvious sign. Hormonal imbalances. So especially for men, if you have low testosterone or androgens, that's a pretty common sign. For women, it would be more like your estrogen and progesterone. And then cardiovascular issues. So if you have hypertension or high blood pressure, that's a sign of sleep apnea, or an arrhythmia, which is an abnormal heartbeat. That's also a sign of sleep apnea. Now, I realize that a lot of people who drive are not necessarily spending a lot of time in bed at home. So this might not pertain to them as much. But if you have a bed partner, like a spouse or a girlfriend or a boyfriend, if they notice that you stop breathing, or if you snore, or if you gasp, that's a pretty obvious sign that somebody has sleep apnea. So those would be the main things. And then another thing that people often associate with insomnia, so an inability to fall asleep or stay asleep, can also be a sign of sleep apnea as well. So I have a lot of patients that come to me thinking they just have really bad insomnia when it's actually sleep apnea stuff.
If a driver is in a crash, could he be blamed for or diagnosed as far as this is part of the reason why this could have occurred?
Yeah, so one thing that insurance is doing a lot more is testing crash victims for sleep disorders like sleep apnea. And this is because when you have sleep disorders, not just sleep apnea, but there's a wide range of other sleep disorders that cause the same thing. But when you have something like sleep apnea, because sleep apnea is so sleep depriving, you're not getting that deep, refreshing sleep. Your brain will cause something called a microsleep, where you can fall asleep kind of out of nowhere in a lot of cases while you're driving for a few seconds or longer. And these come on very suddenly. And so we often see these micro sleeps with crashes. So somebody who is, that's why somebody with sleep apnea is at a much higher risk for crashes and workplace related accidents than somebody without a sleep disorder, because somebody without a sleep disorder, their brain is not going to try to initiate these micro sleeps that are occurring. And if you imagine it, like, depending on the circumstances, it might only take a couple of seconds to get into a crash. You know, even though you might wake up, it only takes a couple of seconds to lose control of the wheel or rear end somebody or go off of the road. So that is why insurance is making it a priority to test people for sleep apnea after these accidents occur, because they're trying to figure out why they occurred. And it is a big mess, but I think more companies that employ drivers are now screening their drivers for sleep apnea to ensure that their drivers are treated before they get them on the road for this reason.
And so if a person does have it, one night of treatment and now they're okay?
So it's not a single night treatment. It's a lifetime treatment, but the diagnostic process is usually a single night. So typically if somebody is suspected of having sleep apnea, there's many ways you can get tested. So the most common way and the most traditional way is to spend a night at a sleep lab in a hospital or a clinic. And they'll essentially ask you to sleep in a bed, and they will connect you to a bunch of sensors. So some sensors will be on your head to measure your brainwave activity. Some sensors will be on your body to measure your breathing. And they will diagnose you that way. About half of people who get diagnosed are diagnosed in the home with home sleep studies now. So you'll be sent equipment to your home that you'll wear at night. Now, there's a lot of controversy in the field of medicine whether or not you can actually diagnose somebody off of a single night. We're definitely moving more towards multi-night studies, so testing somebody over several nights as opposed to one, just to get more robust information about that individual. But once you have a diagnosis, you'll usually be placed on a therapy. Typically, the first line treatment would be something like a CPAP, which is a machine that you wear at night that delivers air into your throat to keep your airways open. It looks kind of like a Darth Vader mask, so it goes over your face. That is a lifetime treatment. So once you're on CPAP, you're going to stay on CPAP unless there's a specific reason why you're having CPAP or sleep apnea that we can actually see that can either be corrected by, one, weight loss, or two, a surgical correction. So this might involve something like removing your tonsils or removing excess tissue from your throat. Surgical corrections or weight loss can be a permanent solution. So after retesting, if it's determined that your sleep apnea no longer exists, then you don't have to worry about additional treatments. And there are some other types of treatments like oral appliances, kind of like retainers that you wear at night, that also correct your sleep apnea as well. But I would say more often than not, the treatment you go on is going to be something like a CPAP, and it's going to be something that you have to be on for the rest of your life, unfortunately.
Wow. Yeah, I didn't know it was a lifetime thing. I thought that they were going from 1 day to maybe 2 weeks is what I thought that they were discussing, but a lifetime. Wow. Yeah.
Yeah, it's again, it really depends on the cause of your sleep apnea. If your sleep apnea is purely caused by excess weight, then going on a weight loss program is potentially going to cure your sleep apnea, but not always. So we always have to reassess after you've gone through a treatment program to make sure that your sleep apnea is actually successfully corrected.
So now this is something that you would have to go through as far as like a professional that is a professional in the field. You can't just go through your own doctor.
It depends on your company. So there's a lot of companies that employ drivers that have a sleep testing protocol in place now. They may use a specific sleep testing company or organization. But if you think you have sleep apnea, you can always go to your own doctor, your primary care physician, and usually what they'll do is they will give you a referral to a sleep specialist, and then you will go see that sleep specialist in your area. Alternatively, there's a lot of home sleep testing companies. I work for one of those companies where you can get a referral to that company, or you can go directly to that company for testing, and they'll send you the device that is needed to actually test your sleep at home. And then you'll get your results and see a doctor through that company. So there's a lot of options, but for drivers and other people who work in transportation and in shift work especially, a lot of time your company that you drive for will have a preferred sleep testing company that they use.
It's a big subject because they give us a 10-hour break and we're supposed to rest between that 10 hours. But, a lot of times you're not going to really get that full 10 hours because the world is just not just perfect. You may not find, parking. It could be someone emergency on the phone. You end up talking to someone else or whatever. And a lot of times, it's common that you're not going to get that full 8 hours a night. So is that something that, just about every driver almost could possibly be tested for this?
Yeah, so there's a variety of reasons why you might not be sleeping well. Not just sleep apnea, there's tons of different sleep disorders. There's over 80 sleep disorders, and then some people just have poor sleep generally, and it has nothing to do with a sleep disorder. It's just kind of something that you developed over your lifetime. One thing that we commonly see in people who work crazy hours is that because they can't keep a regular sleep schedule, their brain has to adapt by allowing them to basically put up with less sleep than would typically be recommended. So we know from clinical science, decades of clinical science, that adults really do require 7 to 9 hours of sleep a night to maintain health and feel well rested. But we also know that people who are chronically undersleeping, their body kind of adapts to not sleeping enough and makes them feel fine, even though they're probably not. So even though you mentally might feel okay, in the long term, that sleep loss does accumulate and it can cause a bunch of health issues. So in that case, we would definitely recommend working on things like your sleep hygiene, which are all the habits and behaviors you do that can affect your sleep. So making sure that you are trying to keep a consistent sleep schedule, make sure that your sleeping environment is really conducive to good quality sleep, not consuming too much caffeine close to bedtime, things like that. So there's a big, huge list of things that you should be doing. And also looking at other sleep disorders like insomnia as well, because somebody who is undersleeping that much, or they say that they can only get 4 hours of sleep, even though they try to get more, that would typically be indicative of insomnia, where your brain is just not allowing you to accumulate enough time. So it is worth talking to your doctor because there are medical steps that can be taken to ensure that you are getting more sleep, but also making sure that you're following really, really good sleep hygiene as well.
Now, would something like this ultimately lead to you taking medication?
Mm-hmm. So first, we would always start with the behavioral side of sleep. So we would assess what it is you are doing that is preventing you from getting good sleep. We would assess things like your sleep schedule. how you prepare for sleep, what kind of foods you're eating, how much caffeine you're taking, if you're taking any other like medications. We would look at your sleeping environment. So is your environment dark enough? Is it cool enough? Is it quiet enough? We would assess things like that, and we would kind of help you build better habits to improve your sleep. We would also teach you what to do when you wake up and you can't fall back to sleep, or if you have a lot of issues getting to sleep in the first place. We would give you a lot of tips like, how to calm your mind, how to make yourself sleepy again. And after we've done that for a while, if all else fails and none of that seems to be working, then we would always recommend that you do get tested for a sleep disorder just to rule that out. And if you don't have one, great. We'll move forward. If you do have a sleep disorder, then we would get you on a treatment specific to that sleep disorder. If you don't have a sleep disorder, then we would maybe look at things like medications, like sleeping pills or sleeping supplements. Usually, if we do prescribe sleeping medications, it wouldn't be something that would be prescribed long term. It would be more short term, because we don't like to give people sleeping medications because they're very addictive and habit forming. And they can also cause a lot of side effects too. So they can actually increase your grogginess, and especially for people who drive like yourself. We don't want to make you more groggy than you already are. So we would try to avoid those things. But always behavioral intervention first, then sleep disorder testing, then last would be the sleeping medications.
So I'm glad to bring some awareness to it.
I think the sleep community has necessarily done a good job educating people these issues. I think we're doing a better job now with things like social media and podcasts. We can actually get out and talk about these issues. So that's why I do these sorts of interviews, is just to help bring this information to people so that they can actually get the help that they need.
Anything else?
Yeah, no, thank you so much for having me. If you'd like more information on these issues, I recommend checking out the American Academy of Sleep Medicine's website. They have everything you need to know about sleep apnea and other sleep disorders, and also shift work and how that affects your sleep. And they also have resources on how to get tested if you do suspect you have a sleep disorder. But of course, you should always talk to your doctor if you are having issues sleeping, because they will likely be able to refer you to a sleep specialist for more assessment. Thanks for having me.
Well, thank you. Thank you for listening, and tune in next week for more new and amazing guests.